Rett syndrome is a rare neurodevelopmental disorder that girls get almost exclusively. This disorder is very similar to autism, but it is its own distinct disorder. In fact, it is often misdiagnosed as autism, cerebral palsy, or non-specific developmental delay. Rett syndrome is a non-hereditary genetic disorder that seriously impairs the girl who gets it. She loses any speaking skills she's learned, she has trouble walking and moving, and she needs help doing everyday things like going to the bathroom and getting dressed. 1 in every 10 to 15,000 girls is born with Rett syndrome. In 1954, Dr. Andreas Rett, an Austrian physician, noticed that there were some girls in his waiting room behaving oddly. He was curious, so he looked into their medical history and their development backgrounds. He found that their development was very similar and that he must have come across a new disorder. He then decided to travel around Europe and make his own film about it as he found other patients who had similar symptoms. Then in 1966, he published an article about Rett syndrome in an obscure German medical journal. It was then forgotten about until 1983 when Swedish physician Dr. Bengt Hagberg published another article about it in a more mainstream medical journal. Rett syndrome is caused by a mutated MECP2 gene. This gene is found in the X chromosome and is also the reason why boys don't really get Rett syndrome. If a boy is born with a mutated MECP2 gene, he will die immediately after childbirth. Boys only have one X and one Y chromosome, whereas girls have an extra X chromosome to make up for the mutated one. Boys who get it are hit full force with the entire disease and there's nothing you can do about it. But girls have the backup chromosome. So the severity of the Rett syndrome depends on how many of the mutated genes are turned on. In the past, doctors thought that people with Rett syndrome had less cognitive ability, but now they're starting to think that they really don't and they understand a lot more than they let on that they do. Rett syndrome is diagnosed using a genetic test. Patients also have to meet all or some of the specified criteria. The criteria are the symptoms and they determine the severity of the mutation. Rett syndrome has 4 stages. Stage 1 is called early onset and happens when the child is between 6 and 18 months old. The child may have less eye contact and not care about their toys. Stage 2 is called rapid destructive phase. This stage happens between ages 1 and 4 and can last months. The child loses any speech she has learned, she loses motor skills, she loses control of her hands, and repetitive motions begin, like hand wringing and clapping and squeezing. Stage 3 is a plateau stage. This happens between the ages of 2 and 10 and could last the rest of her life. Her behavior may improve and she may care more about her surroundings, but she probably will still have apraxia, motor problems, and seizures. Stage 4 is late motor deterioration. This stage can last decades. If the patient could walk before, they completely lose that ability, and they have less mobility in general. They can also get scoliosis and have muscle abnormalities. There isn't really enough data about Rett syndrome to really spell out a life expectancy map, but most girls who have it live past the age of 40. That's it for this video. Look in the description below to find out more about Rett syndrome and where you can donate. Goodbye.